kind of got my start in animal welfare in 2008. Shout out to my redhead orange kitty at home who introduced me to animal welfare. So I started out at a local humane society, which was a managed intake shelter. And from there, I worked my way through from starting out at the front desk doing adoptions to management. And I had the wonderful pleasure of working for most recently the Brandywine Valley SPCA, where I had the pleasure of working with a wonderful shelter in Louisiana, Tangipahoa, Animal Services, where I did most of my impactful work. And I met a lot of colleagues and friends, new friends in this audience here. So thank you for coming out to support me. But I did most of my work there, helping that shelter achieve their life-saving goals. It was a shelter that went from 23% to aiming and reaching 90% live release rate. So I'm really proud of the work that we did there. To where now I'm working with best friends with the Shelter Collaborative team, and we're working with a lot of groups here. Some of you in this audience that are being a peer mentor to pair shelters together to kind of achieve those same life-saving goals that I did when I was in Louisiana. But enough about me. I'll introduce you to Sarah.
Hi, my name is Sarah Quintanilla. I have been with Best Friends about a year and a half, and I got my start in animal welfare at Palm Valley, at the time Animal Center. You might have heard that name thrown around before, but objectively in 2017, we were the worst shelter in the country. And when I joined, our intake was near 40,000 and our save rate was probably below 30%. And so it was just mass euthanasia every single day. And I actually got introduced to Best Friends because Palm Valley is where the first embed occurred, and it completely changed the game. And that, with all the work from Best Friends, all the things we were able to accomplish, all the programs we were able to start for the first time, we hit 90% for the first time at the beginning of 2020. And there I started out really as like social media, managing an urgent page, which was basically posting the euthanasia list every day, to being on the rescue team, driving a van to San Antonio twice a week, to starting our first community cat program, into management, adoptions, fostering. So again, kind of like David, we share this in common, everything on the life-saving end of things, both at really, really tough shelters. Like we've been probably in everyone's shoes here. I think we can relate to a lot of things, which is kind of what we're going to hit on with this presentation. I personally don't think this is super in-depth. Our thing is really wanting to touch on this in the way you think of moving forward instead of a very specific program right now, because there's so many other wonderful sessions you're going to hear this week about very specific programs. And we're going to kind of touch on how all those things should work together to be able to launch you from going from a shelter, from the pound, from whatever the community might have a negative connotation of right now, to a true pet resource center where you're going to be giving back to the public. And so to start on that, just a quick overview of what we think of as high intake, maybe low resource shelters. This isn't going to be necessarily true for everyone. I think everyone in this room will be able to relate to at least one or two of these things, but at least for where David and I have come from and been to, pretty much all these things are happening all at one time, and it makes it feel like it's impossible to get from where you're at to somewhere in the future. So here's like just kind of the following main things you'll see. We know there's highly day intake. That's kind of the basics, is your shelter is consistently every single day taking more animals than you actually have capacity for. And that looks different for people. For me at Palm Valley, it was over 100 animals a day, and 10 ACO trucks would be lined up outside ready to just drop off. And for some people, that might be just even 10 animals a day, depending on the size of your facility. But either way, we know it's a constant state of overcapacity. And with that comes your facility and the toll that it does on your facility. And where I got my start, and I feel like you can raise your hand or not if you want, but most people can relate, that you're still either in the building that was originally built for the shelter, for the municipality, for your area. And it was probably from like the 70s or 80s, maybe 90s if you're lucky. And even the new facilities, to be honest, I've been to a couple that were built in the last 5-10 years, And you can already see the wear and tear just from the sheer numbers of animals they're having to take in and the toll that it does on your building. So you probably have at least a decent part of your budget dedicated to just duct tape and zip ties, right? And you're just trying to hold the place together while actually trying to get them out. The other thing that comes with that is just your staffing. Obviously, not having a facility that can take on the burden that you're dealing with is hard, but expecting your staff to be able to save every animal that comes in, that gets incredibly difficult. And I think pretty much, again, everyone in this room can relate. You're understaffed right now. You have open positions you haven't been able to fill. You have high turnover. And so your staff just constantly feels a state of burnout. They feel like all of this responsibility is on them and they need to be doing 3 jobs at once to make sure everything that's supposed to be happening is happening. Dealing on the community side, we know we're dealing with low income areas. You know, if we're talking shelters like mine, it was, you know, the majority of the population is either at or below the poverty line. And we know that goes hand in hand with limited resources. There's not going to be a lot of vets in that area, especially vets who can accommodate low cost services that the public really needs. And the shelter is going to have the same issue with that. And then of course, a big one that regardless of your structure, regardless of your size, struggles with public image. I think the bigger shelter you get to, things can be more blown out of proportion and there's a lot of drama behind that, but you're always dealing with some kind of criticism from the public. Whether you're doing it right, whether you're doing it wrong, it's going to be wrong in somebody's eyes. So you could be saving nothing, you could be saving everything, and there's always going to be something going on. I think everyone's been through that, so I'm preaching to the choir. And so going back to the facility part is most of them, again, if you were built like in the 70s or 80s, are not in the most obvious places. And you have that question asked of you all the time. There's an animal shelter? We have an animal shelter? Where is it? Like, and it's just the circumstances of where we were in the past to where we are now that not all of them are easy to find. This is an example in South Texas that's between the water treatment plant and the dump facility that's like on the outskirts of town. So like Google Maps can't even find it. So it just gets really difficult, you know, dealing with kind of where we're going, and cities like, you know, I can't blame municipalities for having to prioritize like a public health facility over a new animal shelter. I think that's pretty relatable. And it's just taking us a long time to get to a point where people will be able to afford new facilities in a better part of town or a more, you know, populated part of town.
So you're in the middle of nowhere, you're in an industrial park, no one knows where you are. So how do you get the community to know where you are? How do you get them to come to your shelter? How can you get more exposure to your facility so people know what resources you have available, what resources they can come in and obtain? So how can you participate in community events to get your name out there in the community, to let people know what services you have? Are there any companies that you could partner with to kind of do some large community-based project or volunteer programs? Are there any local newspapers that you could partner with or newsletters that you could partner with to kind of highlight some of your adoptable animals, or just get some type of information about your organization into the community? Like, are there any events that you could be a part of? Like, how can we get the people to know that the shelter is there, given that you're in this middle of nowhere, off beaten road facility?
And so a big part of that is going to be your mission statement, because you can get people coming through the door, they finally find the shelter. Do you know what your message is to them? Do you know what your mission is? Do you know how you want to serve them? And is the public going to recognize that? And I think that's definitely been a struggle, like a growing struggle of shelters going, you know, 10, 20 years ago to now, is making sure your messaging is really consistent, because that will make such a huge difference in the way the public perceives you. So we just threw up a few that we really like, you know, and we really emphasized here that they don't just address the pets. It's not just, oh, we're saving pets from neglectful situations. That is heroic, but we also need to remember there is a whole person component to this, and it's about 50%. And so we just need to make sure we're addressing that. Like, for example, I'm just going to read one of them, Santa Clara up in the corner. Our mission is to protect and improve the lives of people and animals in our community, or in our county, and we count on the people of our community to help accomplish that goal. That says it all. You want to help the animals, but you need their help to help them. And I think that's so important in your messaging, so people understand the expectation that the shelter shouldn't be expected to just do it all on their own. There's got to be this cohesive, no, we're in this together. The community is not the problem, it's the solution with the shelter's help. And we're going to kind of get more into detail about like how to get there.
So when you look at this picture here, and I know all of you have seen it before you even get to the front desk of the shelter, you may see the shelter has a bunch of printed out notes on the door. They're closed, we're not accepting animals, or whatever resources or information they want you to have before you even have that face-to-face conversation with them. It's just uninviting. It doesn't encourage you to engage in any conversation. You're probably overworked with so many things that you're trying to do. So you just want people to see those notes, read it, and not come bother you. But how do we remove all of that? How do we remove those barriers to where we're engaging in more conversations with the people that are coming through our doors to receive any services that we're offering? Are hours available and accessible to people that are in need of services? Are we open the same time that people are working from 9 to 5 and we're closing at 5 as well? They're not going to be able to come and get any of our resources because we're always closed when they're off from work. So how can we change our hours to be more accessible to the people that need us in our community? Do we have a great workplace culture? Are there people that are in our shelters, working in our shelters, inviting and knowledgeable about the resources that we're providing? Is there any continuity? Is there people giving the same message? Are we treating people with their individual situation case by case with respect, or are we meeting them with judgment when they come through our doors? So how can we open up these barriers and basically streamline some of these conversations and do more individual one-on-one conversations with people that are coming to us for our services?
Yeah, and it's so important that, you know, you can have people walk in, you can have these friendly conversations, but the way you act and your policies need to reflect what you're telling them. And that starts with all of the barrier-free practices. Again, you're going to hear very specific sessions on those things, reviewing your internal policies. And I'm just going to like list a few examples, but that, you know, open adoptions. You're not going to say no to someone, you know, for being homeless or for not having a fenced yard, or, you know, any of those kinds of preconceived notions. I feel like in the past that it was, you are literally saying you're not good enough to have this animal. We really need to dismiss that thought. And that's the whole thing of shifting to conversation-based adoptions, conversation-based return to owner, fostering. Like, unless you're really connecting with this person and hearing what they need to be able to do this job of taking care of this animal, we're never going to get anywhere. And so I think, you know, actions speak louder than words. Everything that you're telling this person about having or not having this animal, or how you're able to help them help this animal, says everything about your culture, about your mission. And that's why we included those examples, is that those things have to go hand in hand. Same thing for field services, intake diversion. You know, are you giving officers equipment to be able to do these things in the field? Are they encouraged to have conversations versus just being like dog Uber? You know, is it something that's throughout your entire organization, you're following through from start to finish?
And then we have to think about who in the community can help us. Are there any programs or organizations in the community that can help us further our mission in which we're trying to achieve? Or can we identify the community needs? Like, do we need more fosters? Are we getting animals into our shelters that are sick? Are there any low cost or free vaccine clinics that we can provide in the community to kind of help lessen the burden of sick animals coming into the shelter? Are there any resources out there where we can put together pet food pantries for the community? If the community we're getting a lot of people coming in with surrendering their animals because they can't afford to feed their animals. Are there any of those services that we can provide the community? And with that, a lot of times that we will find that the community see us doing a lot of call to action. They see us doing a lot of messaging that we need your support, we need your help. And through that, you will get a lot of donors. You'll get a lot of people that are wanting to volunteer and foster and help you and support your mission.
So really quick, I just realized this slide was actually supposed to be earlier. So this is like our outdated version, but it's basically the same. We just moved some slides around, but that's fine. But I don't know, does anyone remember seeing this video? Like, I put this up here because it went viral at the time of this homeless man being reunited with his dog, and just the insane happiness of both parties is really, I mean, it's tear jerking. I don't know how you don't watch that video and don't get a little bit choked up. But that's, to me, I put this up here because it embodies the whole message we're trying to send is like, look at how happy they make each other. What does that guy need to be able to keep his dog? And there's no reason we should say, no, that dog's better off in the shelter, because it's not true. I think we can all acknowledge that. So yeah, if you haven't seen that video, please look it up. You will cry. Bring some tissues. But yeah, I just think that kind of embodies everything we need to change about our mindset. So obtaining resources, and this is like where things have to start. Obviously, operations is an obvious thing. You need to be getting out the animals that you have, but then how do you build up a resource bank to keep the animals out of the shelter? Again, going from shelter to resource center. And so you should be looking at fundraising at all levels. And that means, you know, putting yourself out there. That means transparency. That means acknowledging that you need help. The other thing that we added in there is like, obviously Best Friends has a lot of resources. And I think that's a great place to start. That's why you're here. You know, we're here to help you. And even if there's like not an opportunity that's directly correlating with what we're doing with what you need, we probably know someone or know an organization that can give that direct help. And then like specifically medical support, because we do want to talk about like low cost vaccination clinics offered to the public. Like these are just a few, you know, options that are out there. Petco, the actual like vaccine producers, they will probably have some kind of like deal if you're buying in bulk, if you're buying, you know, if you have like nonprofit status. State funding, it totally depends on where you are. Like Texas did have like spay neuter funding available, I believe in 2022. I don't know if they renewed that for 2023. It didn't seem like they did, but I mean, you really do have to go out there and do a lot of digging. I feel like I don't really need to tell you guys that. But I mean, it really starts with acknowledging that you need help and being able to, again, the messaging, like being able to say that really succinctly, and how obtaining those resources we will be able to help the public and in turn help the shelter. And like even your chip discounts, right? I know not all softwares do this, but for the ones that do, like just look into it. Like it never hurts. The worst thing you're going to be told is no, and you'll just be in the same boat you are now. You know.
And then you also, well, to piggyback off of the Best Friends Network, but I encourage all of you to, if you are a shelter that's thriving, to join the Shelter Collab, because it's an awesome program. So, but and we do a lot of great things. So, but you just want to engage your community and start with a pet food pantry. If there's many shelters out there that get food donations from like the local, the national pet food chains, and they will provide food for a lot of the pet food pantries that you're trying to start in your community. There's also like shopping centers or grocery stores that will also donate food to you. So how can you engage the community and start any pet food pantries out there for the community? And then also partnering with your human-based support groups. There's a lot of state funding groups that work with low-income communities. And a lot of times when you're dealing with the low-income communities, they also have pets as well. And they're just trying to make ends meet for themselves and their animals. So how can you partner with those human-based groups to kind of provide some of the support and resources for the animals that they have in their homes as well?
Yeah, and I'm going to backtrack just to the spay neuter stuff because I didn't hit on that. But I think I keep saying that. I know everyone's going through the spay neuter shortage, vet shortage in general, and nobody has access to vet care right now. And if you're trying to hire a vet, the chances of actually getting one are very low because there's just not enough of them graduating and going into shelter medicine. And that's why it's really important to start engaging with your local veterinarians, even if that's just one clinic, right? Try to start having those conversations. It's not easy. You're going to get told no. You're going to get told a lot of reasons why private practice might not want to support you, but it's really important to keep going back to those conversations. Talk to your city about it or your county, because like if there's any type of partnership that can be had, everyone in that community, private practice or not, needs to understand that you're in this together. And so that's just such an important piece to have those connections. And even if you can get through to one clinic, they'll talk to the other clinic and talk to the other clinic. And this is a bit like broader, and I know not super attainable for everyone, but talking to if your state does have like a low cost clinic or a mobile unit or something that might be able to come to you. And that's exactly what like Best Friends, Petco Love, Maddie's Fund, like what those grants are for, is if you need the resources to come to you because they're just not attainable in your area, you really need to put that out there, that that's your only option. And for a lot of people, that's true. Oh, yeah, sure.
For-profit veterinary clinic as well to get low-cost spay neuters and low-cost vaccines.
Just if anyone didn't hear, she's from My Pitbullist Family, and they have a resource center, low-cost vaccine, you said, and clinic options. So do you guys have a booth in the exhibit hall?
We do have a booth. Okay. We are not a shelter or adoption place at all, but we work with the community to keep pets at home with people. So we work really close with Minneapolis Animal Care and Control, and then so we have a resource center that we're really hitting, like we're trying to keep like food and things like that, and how we have been able to expand because we've had people in the last year because, as we all know, the economy and everything else, and so more and more people are coming to us, and so like we have that homeless person up there, and so we have transient people come to us all the time and get food once a month and things like that because they do need their animals, they want their animals, and they should be entitled to be able to keep their animals. So we do provide them with food and litter and things like that. We have people that live in their car with 4 cats, and they should be able to live in their car with 4 cats.
So that's just another one for the previous slide. My Pitbullist Family, they have a booth in the exhibit hall you guys can go check out, which is another great thing about conference, is being able to connect with groups that, I really hate having to research things online if I don't know like exactly what I'm looking for. So just, it's obviously a great opportunity to explore, but just like transitioning into the whole, once you're building up your resource bank, like I mentioned earlier, that now it's time to redistribute to the public, right? And intake diversion should be started right at the beginning. So this one's kind of like, you need the resources to start it, but you want to start it as soon as possible. So what does that look like for you? And that goes back to David's point of opening your ears and listening to what the community needs. And that's even analyzing your data. Like, what is your biggest reason for owner surrenders? Is it because they don't have proper housing? Is it because they don't have food, vaccines? Is it always like a training issue? And there's a lot of behavioral issues in your community, as we've seen come out of COVID, right? So start listening to those things, because that will help you narrow down what you should be focusing on versus saying like, no, I need everything all at once, which is really hard for a group to look at it for a grant and be like, yeah, we'll just give you everything. Like, it's really good if you can be succinct and specific about what you need.
And how can we equip our officers in the field to be an extension of our community engagement and resources? Can we provide our officers with food in their trucks, so when they're out on these calls, they can provide food to those people that are in need food through those conversations that they're having with those folks that are in need? Are there any tools? I know I've worked in shelters where we've had broken kennel doors, and we did some makeshift to put it on the kennel with zip ties to prevent the animal from coming out. Can we do some of those things out in the field to homes like that we're getting calls about dogs constantly getting out of the yard, and you look at the fence and there's a little hole and you see where the animal is getting out from? Can we implore that officer to then fix that fence for that person? Is there anything that we can do to keep our officers from bringing the animals into the shelter? Simple as carrying a microchip scanner to scan an animal out in the field and find that owner, take that animal back to the owner, but then versus bringing it back to the shelter. Just utilizing the officers to do some of that offering community resources and community engagement.
And carrying food in their trucks. Mm-hmm. And is something that, when we talked about the human support groups that can work in tandem with animal welfare, is like Wellness on Wheels, right? Or Meals on Wheels, I mean. Can they be distributing pet food? And if you don't have that in your area, I don't know, like we don't have that in our area, but can the officers be doing that? I've never talked to an officer that carried food in their truck that was like, yeah, I have all this food and it stays there till the end of the day because nobody wants it. Like, people will take it if you offer it to them. So like, it's just something that will build trust in your community. I've met officers that like, yeah, the public when I drive by always gives me the finger or whatever. And it's like, that will really start to change. Again, your narrative, the public's perspective of you as a shelter, municipal organization, all of those things go hand in hand with each other. And like with the community engagement piece, all of your staff should be engaged in doing that. That should be something like, you should be able to really trust any of your staff to do like an interview with your local news station, because they should be able to repeat the messaging. They should be able to talk about what your mission is and how you need the public's help to do it. There shouldn't be this control of like, no, I don't trust you to say this. Like, no, all of your staff needs to be empowered to do that. And if you don't have a specific staff member assigned to doing events, which, you know, that's really hard budget-wise, I get, you know, that should be, again, something you can trust all of the staff, hire an intern even. Like, people want to do these things. It's just allowing the people to come to you to do them and finding a way to let them do it. And then like low-cost clinics, and David and I have both had experience with this, and I think the biggest thing we can push here is efficiency. Is, you know, whether you do them as walk-ins as they come into the shelter or as like drive-throughs, you do them once a month. It's just really important to start to like, what's the word I'm looking for? Just make it more efficient for being able to service more animals every time, you know? The more animals you service, probably the less animals you'll have to deal with walking in your doors later on. And more people just get to know you. More people will start to say good things about you and spread the word. And that's how you start to get your like mid-level donors, going back to fundraising. Like, all of these things just go so much hand in hand if you can do them all successfully. Utilizing your software, you know, even if you don't use Clinic HQ, which I don't know how many people use Clinic HQ, but even Shelter Love and Pet Point can probably help you streamline these processes of your clinics and things like that. Or if you want to use Clinic HQ, that's great. And I just started using it and I think it's really cool. Like, just find what works for your organization. And again, this is why we gather in conferences like this, is ask people what they do. If you see that, oh, they have really successful clinics and they're servicing like 1,000 pets a month, like, what are they doing? Is it going to work for us? You know, so just things like that. And then it's just really important, like, our kind of closing point here is doing all these things at the same time, which sounds like, you know, kind of the same thing that I said about the staff, is everyone's overworked. And I'm just telling you, like, yeah, you got to just do everything at once. But it's really important to build yourself up in that capacity and don't let any of those things fall. Don't let any of those things fail. Build up your operations, get yourself really steady, start obtaining your resources, putting yourself out there, and then giving back to the community. And you'll start to see it kind of snowball and cycle, and it'll just start to flow pretty naturally if you consistently do all of those things.
So I think we have time for questions. So are there any questions out in the audience that you may have on what we talked about? Are there any people in the audience that are doing anything different in their community than what we talked about that you would like to share?
So just to repeat the question really quick, because I know they're recording, is how to reach like an underserved community that isn't coming to your doors, that really isn't, like, I guess, receiving the message, doesn't really know of your existence or know your message. Basically, like, how to reach that really underserved population that is not very accessible to you, or you are not accessible to them.
So, I mean, I would recommend trying to find a way to get into that community, whether it's a community leader that you can talk to kind of open the door for you to be able to get in there and provide some services. I would start out with maybe doing something free, so the community doesn't feel like they're obligated to do anything. It's like everybody comes, I know I come for free food. So if you say you have a sign for free food, I'm there. So how can you partner, get into that community? I would start with like a community leader. If there's any type of community center or any council member that is in that community that can open that door for you, I would start there first.
And I would also say too, and we've seen this with a couple of groups that we work with, is that they will plan just even like a small chip event, just free microchips, if you can get them from like an organization, or if you get a deal with the chip provider, or vaccines, even if it's something small where you say we can only do 200 animals or something, but you're physically going to go to that location, advertise for it, and do it there. Because, and in those specific communities of the groups that we work with, those people do not have transportation. They probably don't get the paper, may not have a TV to see the local news. Like, it's truly inaccessible to expect them to just be on social media and be able to see your Facebook, you know? So I would recommend just doing some kind of event, even a pet food giveaway, right? Because food's going to be cheaper than like chips or vaccines, but just something that will literally put you in that community, giving out things. And that way people will come talk to you, and you can start talking to them about all the stuff that you can offer. Unfortunately, in those situations, I don't see a better way out of it other than physically you have to go to them. And I know that's can be hard, but I think volunteers get pretty motivated about a mission like that, where you're like, I'm truly going to a place where people do not have any other options. And that's good for grants as well.
And I was just in a meeting yesterday, and someone mentioned that if you advertise that you're giving out free wet canned food, that people will definitely come out. So
especially
maybe we start there.
I saw another hand go up. Yeah.
Say the same thing. Like, as soon as there's 50 of them, they tell the entire neighborhood about you. So the biggest thing is like hold your event in that neighborhood. Get in, like, if there's a free, so we always go to like this free food giveaway. It's Fresh Food Friday, and we give away like little doggy treats, little things, cat treats and dog treats. We have our information, like if there's Spanish, if there's things like that, so that people of those other cultures will be able to read the information. The other way to get in is a lot of times in those communities, unfortunately, they don't like to spay and neuter. They want to breed. They want to be able to make money off of the puppies or the kitties and things like that. So hold a free education event in that neighborhood, in the library or something like that, and literally go door to door and put your flyer on each door. And that will really get you into that community, and hold an education event, giving away free food or free treats or something like the wet canned food. And it's just getting your information right there, and you have to do it in that community if you're trying to use it. Huh? Yep. Yeah, so we have our free food, it's called North Minneapolis Pet Resource Center. And because Shannon, our director, had done studies, and she realized like North Minneapolis is surrendering their pets at a higher rate than anywhere else in Minneapolis. And so that's why we put our center right in North Minneapolis. And our center is very small, but we went from when I started a year ago doing 15 to 20 families in 3 hours to 40 families in 3 hours that come in and get resources. And I would tell you more than half of the people are brand new people every shift that I do. And we do it 3 days a week. And so like they will like fill it out and give like the resources, but we don't hold them like, we don't care about what your income is. We don't care about what, where you come from, because it's super important. We don't know what somebody's situation is, why they are getting spayed and neutered. Thank goodness that somebody is coming to get that resource regardless, because we want to stop that population from growing. But like you said, like as soon as you get that word out,
Do you really want to give me the mic?
Hi, I really don't have a question. I just have a comment. I'm a best friends employee, but besides that, I've always been an advocate. So um, I think the first step, and I know that they have said this presentation is amazing. I know David personally. Um, the way to get into the community is by being a part of that community, not being, pointing fingers outward, not saying we're here to help them. Not, it's not us against them. It's us together. It's us together. And I cannot stress enough that to be a part of that community means to respect that community, to know that there's community wisdom in that community. There are people that are doing TNR and trap neuter T and VR and every sort of, and there are people there that are feeding the loose cats and the dogs and spaying and neutering out of their own pocket. And so to get into that community means to literally get on that street and find out who are those folks, who are those superheroes. Let's bring them in, let's fund what they're doing, and let's make them volunteers and leaders on our staff. That's what I'm saying. That's it.
Great point. Make sure your team that you're going in looks like the community that's going in. Make sure you have them be the front and the volunteers. One thing I wanted to add from Chicago, from the streets of Chicago, in Inglewood, I don't know if you think of this, the church. I mean, church is everything in Inglewood to us. They know everybody. That's where all your community meetings are. That's where everybody knows everybody. They can introduce you there. That's a great way to get in, to meet people, to talk to people, to the point you could be based at the church with your vaccine clinics, your pet food. And I'm telling you, Miss Gladys is there. She knows everybody in the neighborhood. Okay? It's one of those neighbors that know everybody. Oh, yeah, they're okay. And then before you know it, you have kids coming in that want to help. And before you know it, your whole pet food pantry, everything you're doing is all the community helping. They're the face, and people will come. So just keep that in mind. Think out of the box when you're thinking that way.
Thank you.
Oh, she's coming with the microphone.
I have a question about the seniors in the community. It's a great idea to do Meals on Wheels, but what are people doing for those seniors that end up in rehab facilities or hospitals that have to turn in their dogs and cats?
I would say the best thing that, and it's easier said than done, a safety net foster program, I'm sorry, of literally talking to fosters that want to do something temporary. I know it's hard to say in those situations, especially in medical situations, you don't know how long they're going to be in the hospital. We dealt with one like domestic violence case where this woman had to go into the shelter, could not take her cats with her. And it's really working one-on-one with a personal foster, I think, that you know quite well. And you can start building out your base because you know that foster is more invested in a story or a person or a specific animal, and you'll have those fosters that are not interested in that. But, as you get to know your foster base, you'll be able to, I think, find those people, talk to them. And it might just start with 2 people. But again, right, it's word of mouth. The more they do it and the more they see a happy ending that can come from it, they'll spread the word and you can slowly start to build that out. It's going to take time, but that really is your best option, is to get a foster on board that is aware of the situation. They know they cannot adopt these animals, and they understand like the time commitment might be a little bit up in the air, but they're invested in the story and want to be a part of that solution and can even talk to that person that's in that situation. Yeah, so add to that.
Yeah, our Minneapolis Animal Care Control, we work really close with them. They've become a no-kill shelter, which is great. So they partner with fosters throughout our community, and they take emergency situations those seniors bundle, transitional care units, domestic, aka somebody that is, lost their housing for a short time, things like that, that they know that is just a transitional period, and they will take them in the group thing that I have to surrender.
I saw another hand up in the back.
Yeah. Yeah, we have a Safe Pet program at our shelter. So we partner with the hospitals and we do temporary care for people that are in the hospital, homeless, um, domestic violence, fire in the home, any kind of disaster in the area. And then we take them for as long as we have to.
And I do think I should add too, the expectation should not be that the shelter holds on to those animals indefinitely. I think, I mean, maybe depending on your situation, you can do that. I'm not going to rule that
No,
out.
we take
but-
them into foster care.
Well,
Like
that's,
what you
yeah, and that's what should be pushed is that you are not a kenneling facility, right? Again, maybe some of you offer that service and that's amazing. I feel like most people can't, and that's why you really need to push for a foster program option for those animals. Just wanted to add that. Anything else? Anyone else have questions, comments? Well, thank you all so much for coming.
Thank you.
And if you do, I just want to say really quick, if you want to learn more about the program that we're with, Shelter Collaborative, we do have our own setup in the hub, and we're like a peer-to-peer mentorship program between shelters. So if you want to come learn more, come stop by, we'll be there intermittently. But thank you guys so much.